Okay, I think I'd like to make a outrageously exaggerated statement here for a specific reason, because we're going to talk about now about a fungus which I don't know the exact statistics, but I would imagine that well over 90% of all common fungal infections in humans are probably caused by this one specific species here, Candida albicans. And it has a propensity for moist, non-keratinized stratified squamous mucosa, like esophagus, like vagina, like oral cavity. And it also has a propensity, like most fungi in general, for immunocompromised hosts. And they don't have to be severely immunocompromised. I mean, diabetic patients, which have a variety of reasons for being somewhat immunocompromised, are loaded with Candida. HIV patients are loaded with Candida. Um, Candida esophagitis used to be one of the major diagnostic criteria to differentiate HIV positivity from full-blown AIDS. So I cannot uh, exaggerate too much the importance of this one particular fungus. And the statement I was going to make is I bet you that this is probably 10 times more common than all the rest of the fungi put together. Uh, Diagnostically and microbiologically, Candida albicans is primarily a fungus. Here you can see is primarily a yeast fungus. Here you could see a whole bunch of yeast forms. Up here you could see one that has a bud on it. Usually when you see two of these little blue balls and one smaller, that's probably a bud. Now, these little yeasts can actually start growing and to form these little hyphae. And I put the word hyphae or preface it by the word pseudo-hyphae because the microbiologists will tell you they are not true hyphae, they don't have septa, but nevertheless they grow like branches, so we could call them hyphae. So Candida is primarily a superficial fungus with both a yeast as well as a hyphal form. But if it's severe enough, it could form deep infections as well. And another very, very common type of yeast, which is usually a lot more serious than Candida, is Cryptococcus. And Cryptococcus is a yeast, and it can characteristically form deep and even meningeal infections. So it is not the single most common cause of a meningitis, but it's the single most fungal cause of a meningitis. And the reason why I'm showing you this picture here is because it is a yeast. Sometimes it can have a bud, but the capsule is structured in such a way, I forget what the exact biochemistry is, that it repels the India ink particles. So if you are going to order if you do a lumbar puncture and send to the lab, most likely, no matter what this patient has, he's probably going to get an India ink prep. So they'll just take you could do it yourself in your own lab, a little bit of India ink, put into the spinal fluid. And if there's Cryptococcus there, the organism is going to really repel the particles. So these little things stand out like a sore thumb, and that's without even doing any stain at all. And this is the India ink prep of CSF, cerebrospinal fluid, that shows Cryptococcus. And I guarantee you'll all see that in the lab one time or another, because every now and then that pops up. And if it does, chances are this patient has had some type of malignancy and they've been under immunosuppressives, or they're immunosuppressed for other reasons. The molds now, or the hyphal structures that are very common in immunocompromised patients, I could think of two that are always at the top of the list. One of them is aspergillus, and one of them is mucormycosis. And, they can infect skin and soft tissues, but they can also be infect deep tissues as well. I'll never forget a case of an aspergillus endocarditis that I had in an immunosuppressed patient. And zygomycosis, formerly called mucormycosis or lumpy jaw, is a very common cause of fungal skin and soft tissue infections involving the maxilla, and you'll always see a picture like this showing a bizarre, unusual, extreme case of mucormycosis, more politically correct, now called zygomycosis. Okay, let's talk about the classical superficial fungi. By superficial fungi, we're talking about dermatophytes, basically skin and the immediate underlying tissues. The term taenial, T-I-N-E-A-L, or taenias in generally, is referred to as the dermatophyte superficial skin fungi. And remember, taenia is strictly a word meaning superficial skin infection. The actual genus or genera of fungi which cause taenial infections are almost always one of these three: epidermophyton, microsporum, or trichophyton. So if you have a superficial fungal infection of the skin and you wind up identifying it, sending it for culture or whatever, it's going to wind up coming back as one of these three things. Often the taenias grow in a circular fashion, so that's how they get the name ringworm. You can have ringworm of the scalp. You could have a superficial infection involving the beard area, or what they call taenia barbae. You can have ringworm or a superficial fungal infections involving the torso or extremities, or ringworm of the body. This is also another taenial infection. Another common place to have a taenial infection is in the groin area, or taenia cruris, common name jock itch. You can get a taenial or superficial skin infection in the areas between the toes, or taenia pedis or pedis, otherwise known as athlete's foot. And technically, you may have had it or seen it. It's very, very common, but for some reason, it's always the most common between the last toe and the second to the last toe. But technically, it could be in any of these areas between the toes. And last but not least, the taenia infection of the nails doesn't have the word taenia at all in it. It's generally known as onychomycosis, Onychomycosis. So it's basically the same type of organisms that are causing taenial infections of the skin, but when they involve the nail, they're no longer called taenias like the skin ones are. They're called onychomycosis. And that's a rundown, 5-minute rundown of the taenial infections of the skin and nails. What about the fungi that aren't superficial? What about the ones that infect the deep tissues, and particularly, most likely, the lungs? Well, those are the deep fungi. And there's a bunch, but we're going to talk about the three most common ones. In fact, the histoplasmosis, blastomycosis, and coccidiomycosis are generally always lumped together in the same term to talk about the deep or often pulmonary fungal infections. And they're completely different fungi. A couple of them look a lot like each other, like blastomycosis and coccidiomycosis, because they're both yeast. They both form these little balls. I think coccidio is a little bit bigger than blasto, as you can see here. Histoplasmosis is a much smaller organism, and it forms little granules inside of macrophages, which you could barely see on regular microscopy. But I would like to reassure you that if you do special fungal stains for these organisms, either a silver stain or what they call a PAS stain, per-iodic acid shift, which are commonly done in the lab, these things really stand out very, very nicely. We'll talk more about these fungi when we get to the chapter on lung, because the deep fungi pulmonary infections are also often categorized as the chronic type pneumonias as well. The thing to remember about them the most is that they all mimic TB. Clinically, morphologically, they're all granulomas. They tend to calcify in the lung. So deep fungal infections are usually these three. They're often pulmonary, and they all can be confused with TB, and I thank you very much.